So we have seen the normal anatomy of the penis, having two corpora cavernosa, the corpus spongiosum, the squiocavernosus muscles, and the bulbospongiosus muscle, and the bulb of the penis and two crura of the penis attached on the squiocavernosus muscle, and the cavernosa are having the erectile tissue having trabeculae and sinusoids which are filled with blood at the time of the erection. But what is the real problem which brings the patient to the physician? The real problem which brings the patient to the physician is inability to achieve and maintain the erection which should be satisfactory to penetrate the vagina at the time of the sexual intercourse. So what is the real problem and how it should be diagnosed by the physician or the sex therapist at the time of counseling of the patient, and how he can reassure the patient and bring the patient out of the scenario. So this is the normal anatomy of the penis and erection, and higher centers like the hypothalamus, limbic system, frontal cortex, the reticular formation, especially the reticular formation of the midbrain, and the preganglionic neurons of the S2, S3 and S4, which are in connection to the higher center through some descending or the efferent tracts, are also modulating and coordinating and controlling the act of the erection. So how the patient will complain, and the patient is coming to the physician to come out this real problem. So what are the signs and what are the symptoms of the erectile dysfunction, and how it should be diagnosed by the treating physician or the sex therapist? Signs and symptoms. So what are the signs and symptoms of the erectile dysfunction? Proper history taking by some points. There should be some points during the time of interview or time of history taking. So first point should be sexual history, this history should include the marital status of the patient and other history also, when the patient was in the when the patient was not in this condition of erectile dysfunction, and how the condition of the erectile dysfunction was started, and when the first time patient felt the condition of the erectile dysfunction. So sexual history may include the marital history, the extra marital relations, the history of masturbation, so these are some points which should be asked during the time of the interview or time of the history taking. Medical history. The history of medications. Is the patient is suffering from hypertension? Is the patient is suffering from BPH or benign prostatic hyperplasia? Is the patient is suffering from diabetes mellitus, which can lead to neuropathy, diabetic neuropathy, and blunting of the autonomic nervous system. In that condition also patient can suffer from the erectile dysfunction, or due to some cholesterol diseases or due to increased level of cholesterol for long time can lead to atherosclerosis and finally erectile dysfunction. So history of blood pressure. Some anti-hypertensive medicines can lead to erectile dysfunction. So there should be proper history, point by point should be taken at the time of history taking. The history of neurological disorder. History of the psychosocial status of the patient and history of some antipsychotic medications. History of the diabetes mellitus and history of the anti-diabetic or oral hypoglycemics, which can also affect the quality of the erection. So history of the anti-diabetic medicine should also be considered at the time of the interview. The psychosocial history plays key role during time of history taking and time of the interview of the patient. About 70 or more than 70% erectile dysfunctions are due to psychosocial factors which are affecting the central nervous system and the nervous system of the patient and can lead to erectile dysfunction. So this is very key role playing factor during time of history, the psychosocial. Patients should be fit psychosocially to perform satisfactory intercourse and to gain satisfactory erection at the time of the copulation. Other diagnostic criteria depend on the physical examination of the patient. How the patient should be examined physically. To diagnose the erectile dysfunction. So physical examination. Patient should be examined for blood pressure, as I have told already. Blood pressure should be recorded for the physical examination and rule out the causes of the erectile dysfunction. So blood pressure should be normal, and if patient is taking some anti-hypertensive medicines, there should be complete history of these medications at the time of the history taking and physical examination. Peripheral pulses. To rule out the atherosclerosis and other vascular diseases, peripheral pulses in the radial artery, femoral artery, dorsal pedis artery, popliteal artery and the carotid artery should be recorded at the time of the physical examination to rule out the vascular component of the causes of the erectile dysfunction. So, blood pressure, peripheral pulses should be noted at the time of the history taking. Sensations. The all sensory modalities including the pain, touch, temperature and pressure should be examined at the time of the history taking and physical examination to rule out the blunting of the modalities of pain, touch, temperature and pressure. The touch modality is playing key role during time of the sexual intercourse and it is also playing important role for the erection of the penis. So, pain, touch, temperature and pressure should be noted. Status of the genitalia, and the prostate. What is the status of the genitalia, the external genitalia and the prostate? I have told already, the BPH, the benign prostatic hyperplasia can also lead the erectile dysfunction. So, it should be examined during the time of the physical examination to rule out the causes of the erectile dysfunction. Testes and the status of testes, the texture and shape, either they are enlarged or constricted. So, size and the texture of testes. Testes are having seminiferous tubules. Testes are having some sustentacular cells or Sertoli cells which are secreting the hormone testosterone, and the hormone testosterone is also playing key role for the erection. So, what is the size and what is the texture of the testes should also be recorded during the physical examination to rule out the cause of the erectile dysfunction. So, these are factors. Besides these all, there are some other factors. The epididymis, and the vas deferens, also known as ductus deferens. On the posterior part of the testes, this is the testes which is having about 1 million seminiferous tubules. All are draining in the epididymis. This is the neck, body and tail of the epididymis. So, this is the epididymis, can be felt on the posterior part of the testes. It remains continue in the upper lateral part of the scrotal cavity and in the spermatic cord as the vas deferens or ductus deferens. It can be felt cord like in the posterior lateral part of the scrotum. The position and the texture of the vas deferens and epididymis should also be noted during physical examination. The most important, the penis. The physical condition of the penis and some abnormalities of the penis should also be recorded, like hypospadiasis, the position of the prepuce, corpora spongiosum and corpora cavernosa should also be checked for some atherosclerosis or rigidity of its walls. Besides this, the ligaments, the fundiform ligament and the suspensory ligament should also be examined during physical examination of the penis. So these are the criteria should be examined during the physical examination of the patient of the erectile dysfunction. Besides this, there are some lab diagnostic criteria to rule out the cause of the erectile dysfunction. To diagnose the condition in the lab, the serum hormonal levels. So levels of the testosterone, luteinizing hormone LH, this is secreted by the adenohypophysis of the pituitary. The serum hormonal binding globulin, the prolactin. So male sex hormone is testosterone, should be examined in laboratory. Luteinizing hormone secreted by the anterior pituitary, that is adenohypophysis part of the anterior pituitary. The serum hormonal binding globulin, it is protein which carries the hormone by binding the molecule. And the prolactin hormone, this hormone is also playing key role. Increased level of prolactin can lead to decreased libido or desire of the sex and can lead to decreased quality of the erection. So all hormones should be examined during the laboratory diagnosis. Complete blood count, HbA1c, for the control of blood glucose in last 3 months. So CBC, HbA1c, lipid profile, liver function test, LFT, and kidney function test, KFT. ECG should also recorded to rule out some cardiological causes of the, although these are rare, but should be ruled out by ECG. So ECG, CBC, HbA1c, lipid profile, liver function test, and the kidney function test. Complete urine analysis. Complete urinolysis, the USG, of the penis. USG of the penis. It is mandatory to rule out the status or the atherosclerosis or the rigidity of the wall, and what is the filling status of the corpora cavernosa and corpus spongiosum. The plain USG of the penis and transrectal USG to rule out the BPH. So USG of the penis, transrectal USG, angiography of the dorsal artery, angiography of the deep artery, angiography of the bulbourethral artery, and angiography of the superficial and deep dorsal veins to rule out the vascular causes of the erectile dysfunction. So angiography. So these are the diagnostic criteria of the erectile dysfunction. Besides these all, there are some special criteria or some special type of test used to rule out the erectile dysfunction. Either it is psychological or it is organic cause of the erectile dysfunction. Injection of the prostaglandin E1. So injection of the prostaglandin E1, known as alprostil. It should be injected by small bore needle. This is the penis. This is the glans, and these are two corpora. This is the site for the injection. If there is erection or if there is turgidity or tumescence after 5 minutes of the injection, the cause can be psychosocial or plain psychological. So it should be ruled out using the injection of the prostaglandin E1 or alprostil. This injection is also used to treat the erectile dysfunction. So these are some diagnosis examinations and the diagnostic lab criteria to rule out the causes of the erectile dysfunction. After a short break, I will talk about the treatment and the sex therapy, how the sex therapy work to treat the patient of the erectile dysfunction and what medications can be used to treat the erectile dysfunction according to status of the patient and age of the patient. So after a short break, I will continue the lecture on the treatment of erectile dysfunction.